Hey guys, welcome back to Man Medicine, where we talk about how men can optimize their health and avoid the collapsing U.S. healthcare system. I'm going to talk today a little bit about how I manage fluid retention on men who are on testosterone therapy. This is not an uncommon problem in a subset of men, certainly not all men, but there's a subset of men, especially when they first start testosterone therapy, that experience, in some cases, fairly significant water retention. I've seen guys gain between 5 and 10 pounds of water weight, sometimes within the first 30 days of starting testosterone. And again, this is something that usually happens in the beginning of therapy. I've never seen it happen in a man who's been on chronic therapy just out of the blue, unless there's some other underlying medical condition that they are unaware of that rears its head. But but it does happen. And what I see quite typically is that men will experience water retention initially. They don't like it. It feel good. Cosmetically, it may be an issue for them. And the knee-jerk reaction that I see and that I hear about other clinicians doing is to start these men on aromatase inhibitors, assuming that it's estradiol that's the culprit. So we bring the estradiol levels down with an aromatase inhibitor, and it should correct the water retention. The problem is that does work to a certain extent. I mean, if aromatase inhibitors, they will improve the fluid retention. And so what ends up happening is that now these men associate their fluid retention with estrogen. They develop estrogen phobia, and they end up staying on an anastrozole or another aromatase inhibitor chronically, which I'm not going to get into in this video, but has a whole host of associated problems with it, and is not something that I recommend at all. These are not medicines that I prescribe on a regular basis, although I have to admit, when I was first trained in testosterone therapy, this is something that was done quite regularly, and I have prescribed them in the past. But as medicine changes and we get more information and the field advances, it's important to change your practice to stay up with the times. And so I no longer prescribe aromatase inhibitors routinely, if ever, in my men. And so I like to think, if you put a man on an anastrozole for water retention, it's sort of like you're throwing the baby out with the bathwater. In the short run, you may be improving their symptoms, obviously, of water retention, but in the long run, I think you're doing more harm. And what I'm going to talk about here is my approach to this. I'm going to show you a paper that proves what I'm saying, and present you with an alternative that actually not only works just as well, if not better, but has the potential to be additive in terms of improving your health, longevity, reducing your risk for cardiovascular disease, all of the things that are important to us as men. So what's really happening when you start a man who has low testosterone, and you start them on testosterone therapy? Testosterone in and of itself does increase extracellular water. Growth hormone does too. There's some very well done papers out there that show that definitively. So if you start on testosterone and growth hormone therapy, water retention can definitely be an issue for you. But it's well known that estradiol as well causes water retention, and not just estradiol, but women that take synthetic estrogens in the form of birth control pills or for other reasons can experience water retention. And what estradiol does is it causes water retention in two primary ways. The first is it causes sodium retention. And the thought there is that it probably activates this system in your body called the renin-angiotensin-aldosterone system. What that ultimately does is causes the kidney to hold on to salt, sodium specifically, and water tends to travel with salt. So wherever salt goes, water goes with it. The other thing that it does is it increases the sensitivity to secretion of something called arginine vasopressin hormone. I always have learned it as antidiuretic hormone. That's what we learned in medical school. And antidiuretic hormone, as the name implies, does the opposite of a diuretic. So it causes tubules in the kidney to hold on to free water. So if you start getting dehydrated, let's say you're trudging through the Sahara Desert, your antidiuretic hormone levels will be quite high. Well, what estradiol and synthetic estrogens do as well is they increase the sensitivity, I guess, to the secretion of that hormone. So you don't need to be very dehydrated to get a robust ADH response in the presence of estradiol. And people argue back and forth, which is the bigger contributor. Is it the sodium? Is it the antidiuretic hormone? I don't think it matters too much, but this is why men with fluid retention initially get better on an anastrozole, because the estradiol level does come down, and so the sodium retention goes down, and then this sensitivity to the secretion of antidiuretic hormone also goes down. But like I said earlier, this is throwing the baby out with the bathwater. There are other ways to manage this that, in my opinion, are quite a bit better, that still allow you to derive all the benefits of estradiol, of which there are many, not to mention just the cardiovascular longevity benefits, the sexual function benefits, etc. I'll do another video on estrogen for you guys in the future. But the point is, you want estradiol. You want a robust level of estradiol. You don't want to block it just to treat fluid retention. So what have I seen clinically? If you have mild to moderate water retention, what typically happens is that the body figures it out and it essentially goes away, usually within a month or two. So what's happening there? Well, what we know definitely from studies in women with estradiol, and presumably this is true with men, as this fluid retention occurs, the body compensates. It lowers aldosterone levels, and aldosterone is extremely important hormone. It essentially causes sodium retention. So you hold on to sodium, you get rid of potassium, and when you lower those levels, of course, you start excreting sodium. The water goes with it. So if the body detects this increased fluid volume, it says, that's a little bit too much water. Let's take these aldosterone levels, we'll bring them down, and then the water slowly starts going away. But it doesn't happen overnight. Like, it can take a week or two, or it can take a month. It can take a little bit longer. So if you've just got mild fluid retention, my recommendation is just wait it out. I mean, it's going to go away. I can't think of a case where mild to even moderate fluid retention like that hasn't eventually gone away as the body sort of balances things out. Now, if it doesn't, then we'll talk about here in a little bit about what you can do to mitigate that a little bit. But I think it's important to say that the men that I've seen who have serious fluid retention issues, these guys that gain like 10 pounds plus of water weight, I've never seen any literature on this, but in my clinical experience, these men have a few things in common. All the ones I've seen, and I mean all of them, have been morbidly obese. So, and that's, again, that may be related to the higher estradiol levels that are associated with obesity. As you guys probably know, the aromatase enzyme, which converts testosterone into estrogen, it's preferentially present. It's in a lot of tissues, in fact, almost all tissues, but in visceral body fat especially, it's particularly high. If you have high levels of chronic inflammation from visceral adiposity, you can expect that your aromatase enzyme activity is going to be pretty high. So these men are obese, so they will have higher estrogen levels as a result of that. The other thing I've seen is that almost all of these men, along with their obesity, have sleep apnea to one extent or another. Sleep apnea, I don't want to go too far down the rabbit hole on that, but is extremely taxing on your cardiovascular system. It causes inappropriate activation of the renin-angiotensin-aldosterone system, causes you to retain water, and ultimately, I've seen it in a number of cases in the emergency room, people coming in with fulminant congestive heart failure solely from untreated sleep apnea. In fact, I took care of a guy like that just a few months ago. Had severe right-sided heart failure, massively edematous, and the root cause was sleep apnea. And he was non-compliant with his CPAP, And so it's no surprise that, that happened to him. So anyway, that's the phenotype that I typically see. I don't see skinny, lean guys have significant problems with fluid retention. I'm sure they're out there, and if you're a clinician out there, or if you're a patient who's lean, and by lean I don't mean like modern day lean, like I got 22% body fat. Okay, that's not lean. I mean like 10 to 15% body fat. Let me know in the comments. You're definitely, in my opinion, and from what I've seen, those folks are outliers. And there are people that have these, polymorphisms in the aromatase enzyme. A polymorphism is just a genetic variant that is different than the standard population. And so guys like you, maybe you do convert testosterone to estradiol at a higher rate or more efficiently than other men do. So, I'm not saying that those men aren't out there, but in my experience, the guys that have serious water problems tend to be big. They tend to be big. What do we do about this? So in my opinion, the answer is not to block estrogen. Again, that's throwing the baby out with the bathwater. My approach to this is, as I mentioned earlier, if it's mild to moderate, I encourage guys to just be patient, to wait it out. Those aldosterone levels will come down. The fluid balance will take care of itself. And also, I make all of my guys, you need to be on an aggressive fat loss program right out of the gate if you're not already. Ideally, you've already been doing that before you come see me. But just the fact that you have lost body fat, because of its association with estradiol levels, you can bring your estradiol levels down in a healthy manner just by losing body fat. And many, many times that's sufficient just to take care of these minor water issues. But if you're a really obese guy and you're just you're waterlogged, you're slogging around with fat cankles and you're miserable, I think the best approach, and what I've seen work really well in my guys, is start them on a low dose of an ACE inhibitor or an angiotensin receptor blocker. And these are blood pressure medicines that have been around for a very, very long time. And what they do is essentially, block that renin-angiotensin-aldosterone system. And so you will pee out sodium, and then the water will go with it. The reason I like to do that is, well, number one, it works. Number two is there's decent data that ACE inhibitors and angiotensin receptor blockers have anti-aging properties. I always hate the term anti-aging, but they have the potential to reduce the incidence of coronary artery disease, endothelial dysfunction, the development of left ventricular hypertrophy, which is abnormal thickening of the heart. So they have a bunch of other cardiovascular benefits. So in my opinion, why would you block estrogen with anastrozole, which all of the data shows has, if anything, has negative cardiovascular effects in the long term? Why would you do that when you could take care of this problem with a very low dose of an angiotensin receptor blocker or an ACE inhibitor and fix the problem, but also reap the potential longevity and cardiovascular benefits from that? So to me, that's a bit of a no-brainer. Now, the other thing too that I'll do sometimes, and I can't remember the last time I had to do this, but guys that really have issues with water retention, I may give them a low dose of a loop diuretic, something like Lasix or furosemide or torsemide, something like that, for a few days, just to help them dump some water because they're so uncomfortable. But I can count on one hand with fingers left over the number of times that I've had to do that. So that's an option just to get some of that water done. I'll put those guys on a low sodium diet, and I will hammer them about weight loss. They have to get their body fat down. They have got to get their sleep apnea treated. I screen for that on all my men, and I send a lot of guys for sleep studies. So that's always something that's in the back of my mind, is sleep apnea. So there you have it. I guess we could go on and on about this stuff, but fluid retention, it does happen. If it's mild to moderate fluid retention, don't get excited. You don't need to freak out about your estrogen levels, and I do not recommend that you get on anastrozole because typically you're going to end up on that for life. And there's a whole host of negative cardiovascular, potential cardiovascular outcomes that can happen with anastrozole. And it's just not necessary. So the alternative, in my mind, that works better is a low dose of an angiotensin receptor blocker, ACE inhibitor, very rarely a brief course of a diuretic, and then lifestyle modification, fat loss, and treatment of underlying obstructive sleep apnea if it's there. So that's how I approach it. I think that's much more sensible. I have changed my practice. This is what I do now in the cases where I encounter fluid retention that's an issue for men. And I will just say once again, I don't like blocking hormones, whether it's estradiol, whether it's DHT, that sort of thing. These hormones exist for a reason. They have benefits. And I like that the medical literature is now supporting moving away from that. And I always do my best to try to practice evidence-based medicine as much as possible. Unfortunately, the world of TRT, there's not a ton of new evidence coming out every day. There's just, I don't think the financial incentives are there for the drug companies and the FDA to fund the big studies that we need to really fine tune some of these issues. But in my opinion, the approach I just shared with you guys is more sensible. I think it's safer. And I encourage you, if you're having fluid retention issues and your doctor, their knee-jerk response is to put you on an anastrozole, is maybe share this video with them, talk to them about it. I'll put some links in the show notes about some papers that support what I'm talking about, and please let me know in the comments if you've experienced water retention, how you and your doctor managed it, and if you have any other ways that I haven't talked about that you've managed it that have been successful. I'm always open to learning new things. So let me know what you think, and I will talk to you guys next time. All Man Medicine video and audio has been created and shared online for informational purposes only. This podcast does not constitute the practice of medicine or professional healthcare services of any kind, including the giving of medical advice. I am not your doctor. No doctor-patient relationship has been established. This content is not meant to be a substitute for professional medical advice and should not be relied upon solely for that purpose either. The only purpose of this content is to present peer-reviewed, research-backed health information for your consideration. As always, rely on the advice and guidance of your personal physician before undertaking any activity presented here, and if in doubt or not comfortable with said activity, practice discretion. Your health is your responsibility and not ours. Finally, I take conflicts of interest seriously. I accept no compensation whatsoever from any private corporations, including pharmaceutical or supplement companies. You can trust that if I recommend a medication, product, or service, it's because I genuinely believe in it and not because I'm being paid to endorse it.